So I'm going to talk about different types of stem cells. I'm just going to touch on the different types because there's a lot of confusion over what actually is a stem cell and where you can get them from. I'm going to talk about osteoarthritis and rheumatoid arthritis. I'm mostly going to talk about rheumatoid and the mechanism by which fat-derived stem cells can be useful. I'm going to talk about mesenchymal stem cells, stem cells and the other kind of cells that are found in your fat, and then how the mesenchymal stem cells and the other cells from your fat can reduce inflammation, help tissue repair, and modulate the immune system. So I'm only going to introduce 2 new words to your vocabulary, I hope. And those 2 words are mesenchymal stem cells and cytokines, which are similar to hormones, and they're repair and regeneration factors that are produced by stem cells. They're secreted by stem cells, and Dr. Paz had talked a little bit about that before. But these are the only 2 new words, I promise. So there are different sources of stem cells, and most of the hoopla is over the first kind listed there is embryonic stem cells, and there's a lot of both scientific and ethical concerns about the use of embryonic stem cells. And the first clinical trial using embryonic stem cells started this year in this country for spinal cord injury. A company called Riordan is using the original source of the cells is embryonic, but the cells they're using have been differentiated and they've been made into a kind of nerve cell. So it's not really embryonic cells that they're giving to patients. Then fetal cells. And then we don't work with either embryonic or fetal cells. The only cells that we work with are from the patient themselves or from after a healthy baby is born, the umbilical cord and the placenta that are delivered after birth. They're considered postnatal cells, so there's no individual is harmed in the collection of those. They're considered medical waste after birth. And then adult stem cells, we can find those in the fat and the bone marrow and the teeth and even the menstrual blood. We were the first group to discover that the menstrual blood had significant numbers of stem cells, and they could actually form 9 different kinds of tissue. And we won the Medical Article of the Year award in 2007 for that discovery. So the major classes of stem cells in us, fully developed humans, are the blood-forming stem cells, which are found in the bone marrow. So you have to continually make new blood and new white blood cells, new red blood cells, new platelets, and a lot of people when we talk about cancer therapy. When you get a bone marrow transplant in cancer therapy, what you're trying to do is give a high enough dose of chemotherapy to kill the cancer, but in the collateral damage is the bone marrow, so you're going to die of that. You're going to die of lack of bone marrow after the treatment, so then you need a transplant. So a lot of people talk about have in their minds it's for cancer treatment. And really, the stem cells aren't for cancer treatment. The chemotherapy and the radiation are for cancer treatment. The stem cells are just to save your life afterwards. So they're literally a recovery from that treatment. And then there are tissue repair cells, or mesenchymal stem cells. It comes from the mesenchyme, which is the middle part of the developing embryo, and they're found throughout our body. They home to damaged tissue, as Dr. Paz was alluding to. They reduce inflammation. They're the most potent anti-inflammatory tool that's ever been discovered. They make repair and regeneration factors, and those factors are called cytokines or trophic factors. So there's that word again. They also, by themselves, directly and indirectly through the molecules, the cytokines, trophic factors that they produce, can help modulate the immune system. So these are found in every tissue in your body. They're found around every blood vessel. So if you think about the body being fully vascularized, every blood vessel is covered, including the tiniest, are covered with MSCs, or mesenchymal stem cells. They're found in high levels in the fat tissue, and as we age particularly, they're found in lower and lower levels in the bone marrow. So here's this is the percentage of your bone marrow cells that are mesenchymal stem cells. And when you're born, 1 in 10,000 cells is an MSC. After you've fully developed in your teens, it's 1 in 100,000. And then as you can see, it goes down from there. By the time you're 80, it's 1 in 2 million. So as Dr. Paz was saying, in an older person, a bone marrow wouldn't be a very good spot to go looking for the MSC, the mesenchymal stem cell. So you might ask yourself, well, why do you have this huge drop, 90% drop in the MSCs from when you're born until you're fully developed? And the reason for that is that these cells are used in making your body. So you go from a 7-pound baby to a perfect 172-pound, no. Well, at one point. So, you go to this, you have to build this body. You have to go from 7 pounds to 150, 200, whatever. And those cells come out of the bone marrow, and they're found in every tissue of your body, and they go on to develop every tissue in your body. So this is a scanning electron micrograph, a picture, if you will, of a very tiny blood vessel, and on that blood, which is called a capillary, and on that capillary you find these cells, and these are mesenchymal stem cells. So if you look, this is not a very good picture, but has anybody been to the body exhibit where they have all the bodies sliced up? Okay, so this is from that exhibit, and this is where they've taken and they've rubberized the entire vasculature, the blood vessels in this lucky individual's body, and then they digested everything else away, and this is literally suspended in a like a fish tank. So it's hanging in the fish tank. So you can actually make out the organs, and you can make out the body there. So you can, it illustrates how these blood vessels are found everywhere in your body. You can even visualize the kidneys and the heart. So they're found throughout our body. And if you think about the MSC being attached to every blood vessel, you can see that the MSCs are everywhere through our body. So again, these cells home to damaged tissue, and to illustrate that, if you cut yourself, it will repair itself, right? If it's a huge wound, you wind up with scar tissue, but if you just cut yourself, it will repair itself. And even people recover from heart attacks. Well, what happens is huge numbers of stem cells are mobilized, and they go to the heart and help repair that, right? And if it's so massive that it overwhelms the available number of stem cells, then you'll go on to you'll either die or you'll go on to have permanent heart damage. So it's overwhelmed the body's ability to push stem cells into it. And there are clinical trials going on now where they take additional stem cells just after the heart attack, and they give you a massive infusion of stem cells so that you have more repair cells to go in and fix the damaged tissue, and they're having very good results with that. So they, as I said before, they reduce inflammation, and they make repair and regeneration factors, and they modulate the immune system. So one of the things also that happens with aging is that we deposit more and more of our MSCs into our fat compartment, right? In the fat compartment, these cells are sequestered where they don't do us a lot of good, right? And so as well as MSCs, there are other cells that Dr. Paz described. There are endothelial precursor cells. There are monocyte macrophages. The biggest cell that's also found in the fat is called a T regulatory cell. So I'm here to talk mostly about rheumatoid arthritis. So what is the basic problem with rheumatoid arthritis? The basic problem is there's nothing wrong with your joints. There's something wrong with your immune system. And your immune system is attacking your joints, okay? And so the solution would be induction of tolerance, or getting your immune system to back off a little bit. So this is what happens when you're stimulating the T cells. The problem with rheumatoid arthritis, as well as multiple sclerosis and similar autoimmune diseases, is that you have these T cells that you have a naive cell, and then it becomes activated, and then it starts creating an army of cells. And this army of cells, they're called T cell clones that attack the joint in the case of rheumatoid arthritis. And where MSCs block this is right at the top, and I don't have a pointer, but if just after the activation, then when they start dividing, it blocks this process right at that point. The MSCs, both the cell themselves and the trophic factors, the cytokines that the cells produce, block it at that point. Okay, so this is a study, an in vitro study, a study where outside of the body where they took white blood cells from one person, they mix them from another, and that's called a mixed leukocyte reaction, and it is the mother of all wars. So you put two people's immune systems together, and they just go at it, right? And it's a very pro-inflammatory situation. The T cells start dividing, and they spit off these pro-inflammatory cytokines, one of which is interleukin 23, and this is the first one is there's no interleukin 23. Those are just monocytes by themselves, or mononuclear cells. So the white blood cells from one person or the other person by themselves, they don't produce any of this inflammatory marker. You put them together and it goes through the roof, right? Well, then if you add, then the next one is adipose stem cells, mesenchymal stem cells from the fat, and then there are various iterations of mixing the stem cells with that mixed leukocyte reaction, which always creates this huge inflammatory process, and it's completely abrogated. It just blocks that inflammatory process completely. So, where do you find MSCs? And we talked about they're throughout your body, but there's not a better place to get them from the fat, because the fat has a real high concentration of them. And they're really easy to get. I mean, liposuction, and some people here will argue with me, is a relatively simple procedure. It's a very safe procedure. There's over a million procedures that are done every year in the United States, and the side effects from the procedure itself, at least the severe side effects, are very minimal. There are methods published in the literature when we started this that already showed us how to isolate the stem cells from the fat. And then, of course, fat has these other cells which help induce immune tolerance. So how did we get started in this? Well, we had a couple of brave individuals from this area, one of whom sitting in the audience, who's the first person to ever get treated with intravenous fat-derived stem cells. His name is Richard Humphreys, and he didn't mind me talking about him because he's given me permission. But anyway, he's a multiple sclerosis patient, and you guys can talk to him later about his story. And I think a lot of people have seen him on videos and things. But he and another person from this area asked us if we want to do something else, because we were treating using only umbilical cord cells at the time. And if you think about basically the cost to isolate mesenchymal stem cells from umbilical cord and expand them up, it's relatively large. Well, in 500 cc's of fat, we can get 100 million cells in a day. So it's one of those sort of real practical questions that we can answer by doing liposuction. And these guys volunteered to be the first ever to get treated. And we did the liposuction. We got a significant number of cells, and we actually published on this. We published the first 3 cases, and all 3 cases were quite successful. So we went ahead and used the umbilical cord like we had been doing, but then we also used the fat-derived cells, and there were dramatic improvement in all 3 cases. There were no side effects other than a little bit of bruising from the liposuction, which Richard always kids me because he said, well, you said it was going to be a little bit of bruising, and then he walks in and he pulls up his shirt and he says, you call this a little bit of bruising? In relative terms, like a plastic surgeon for cosmetic purposes, they'll do, 4, 5, 6, 8 pounds of fat, and this is only 1 pound of fat. So in relative terms, it's relative though. So we collaborated with the University of California, San Diego, and we wrote this paper, and basically all 3 cases responded dramatically, and Richard's one of those people. So MS and RA are similar, as I said before. They're both diseases of the immune system. The immune system is dividing, these clones are dividing rapidly, and they're attacking, in the case of rheumatoid arthritis, they're attacking the lining of the joint. In the case of multiple sclerosis, they're attacking the myelin sheath in the spinal cord in the brain. So we had our first patient who, with rheumatoid arthritis, we wrote up her case, and it was published in a scientific journal, and this is the citation for that. But this lady was from Arizona, and I'll never forget, after her first shot, the next day she was better. And we waited 3 days to give her the next shot, and after that shot, she had no pain whatsoever. And that was 2.5 years ago, and to this day, she doesn't take any medication. And it's all written up in this paper, and I think you should have that on your CD. But she doesn't take any medication, and to me, it really bothers me that the FDA considers this to be a new drug, because it's just your own body stuff, So write your congressman. So, the cells themselves have this profound anti-inflammatory effect. They also have the immune modulating effect, and they have the tissue regeneration effect. And I want to talk a little bit about basically the cytokines, the trophic factors that they secrete. They have all of those same benefits. And this is just a cartoon showing, cells secreting molecules. So they have all those same effects, and I'm going to talk a little bit about the tissue repair effect that these cells have. And I'm going to use two examples that are published in the literature. One is for heart failure, and the other is regarding spinal cord injury. And so Professor Lee, University of Buffalo, did an interesting experiment with heart failure. And he said, well, we know these MSCs are good at repairing tissue. We know they're good at calming down inflammation. So let's give them to this hamster model, which is it most closely resembles the human heart failure. And so he said, let's inject some of these human cells into hamsters, human mesenchymal stem cells, and let's see what happens. So he injected them into hamsters, and their heart failure got better. And they said, oh, well, they must have gone to the heart. So they took some of the animals, and they looked for human cells in the heart, and they found very, very few cells. Less than 5% of the cells they injected actually were in the heart. And then he's a very inquisitive fellow, and he said, well, what's going on here? So he said, let's not inject them in the heart. Let's inject them into the leg, into the muscle in the leg, because we know if you inject them in the muscle in the leg, they're not going to go out of the leg. So they did that. They injected the mesenchymal stem cells into the hamstrings of another group of hamsters, lucky hamsters, and they all got better. To the same degree, they got better when the cells were injected intravenously, and some of them went to the heart. In this case, none of them went to the heart, and they got better. So they said, well, it must be something they're putting out. So it's not the cells themselves, it's whatever they're secreting, because they didn't go to the heart. So there has to be something circulating around that got to the heart and helped get better. So then he took the culture medium, the stuff that the cells were growing in, and they're secreting these factors all the time they're growing. And he took that and he injected that into the muscle. And guess what? Same result. So this is a beautiful example of how the cytokines, the trophic factors that the cells secrete, can be just as powerful as the cells themselves. And what's exciting about this is you don't need the cells. And so the cost comes down dramatically, the complexity comes down dramatically, everything comes down dramatically, and they don't necessarily need to be frozen in liquid nitrogen, and they're transportable. So it opens up a whole bunch of other opportunities that we don't have when you have to use cells themselves. So we're very excited about this. And then there's another very good example of the secretions actually doing the work and not the cells themselves. And this is a study that was done in Taiwan with rats in 2009. And what they did is they cut the spinal cords of the rats, and when they completely sever the spinal cords, they'll retract about 1 to 2 millimeters. So there's actually a gap. And so then they took human umbilical cord mesenchymal stem cells, and they suspended them in fibrin. And fibrin is a clotting, it's stuff that helps your blood to clot. And so it's essentially in a clot. And then they on both of the ends of the cut cord, they put these cells in this fibrin clot. So they stayed there. And then what they found was the cords regrew. And then they went to look at the cords because they thought, well, this is great because these mesenchymal stem cells, bridged the gap and they became new neurons and everything. Well, they didn't. There were no human cells in the central nervous system. There were cells that were trapped there, but none of them were actually neurons. None of them were support cells of the central nervous system either. They were just bystanders. So what it tells us is that the secretions of the cells induced the spinal cord to repair itself, and the cells themselves did not become new spinal cord. So I find that very exciting as well. So Dr. Paz talked about this. I'll just talk a little bit about the politics, because a lot of people ask me, why can't this be done in the United States? And as I alluded to earlier, the reason it can't be done here is because the Food and Drug Administration views your own fat-derived stem cells as a new drug, and they should be regulated as such. Our position is that they really should be regulated under the practice of medicine, and we think laboratories here should be certified and certainly deemed to be producing safe product, but that's our position. Just like, as was mentioned, you can get your dog treated and your cat treated and your horse treated, but you can't get treated. And you'll see these sports stars like Kobe Bryant has gone overseas, and Bartolo Colon, Terrell Owens, and Governor Rick Perry, who has I guess a bigger stick, was actually treated right here in Texas. But as far as the FDA is concerned, that's not kosher. So the only reason that this cannot be done by physicians in this country is because the FDA is calling your fat cells a new drug. So in summary, I think adult stem cells seem to be useful for regenerative medicine. Fat-derived stem cells are simple to isolate, and they've shown beneficial effects with few side effects. And a take-home message is it's not just the cells themselves that have the activity, but the molecules that they secrete. So that's my talk. Thank you very much.